The headlines are all too familiar. Celebrities, premier athletes, young adults, even teenagers, all the victims of an epidemic sweeping America. It's called prescription drug abuse, and it's a killer.
The most astonishing and alarming health risk right now is that in the 13 or 15 states that are east of the Mississippi River, in the last 3 years, the leading cause of accidental death has been accidental overdose on prescription drugs, not car accidents. And so people are taking these prescription drugs in an attempt to party or with addiction because they're out of control. They binge on the prescription drugs.
Dr. Ted Perrin of the Addiction Pros has spent more than 20 years specializing in addiction medicine recovery. The nationally renowned physician lectures frequently on the new trends in addiction treatment at forums across the country. He says abusers of prescription drugs don't understand how potent they are.
An astonishing number of Americans are honestly waking up dead the next morning. In addition, there's been a 400 to 500% increase in people being admitted to drug and alcohol treatment programs where their drug of choice is actually prescription drugs, not alcohol or heroin or cocaine or methamphetamine.
Dr. Perrin has treated thousands of patients with prescription drug abuse and addiction. He says the abuse falls into 3 patterns.
One pattern is that a person begins on the medication for a legitimate reason, and then they develop physical dependence, and then they begin to like the feeling of the drug, and then before you know it, they're abusing it. A second pattern is that a person just has access to the prescription drugs. They have a friend or family member who has the drugs around for a reasonable medical purpose, and then the person just steals it from them or takes it from them and abuses it. And finally, it's become not uncommon at all with people being worried about HIV and AIDS for people to actually try to get away from using something like heroin on the street or cocaine and try to move to prescription pharmaceuticals, which they wouldn't use IV, they would use by mouth or by snorting, because they're worried about infectious diseases.
Prescription drugs are readily available through shady physicians who operate pill mills, criminal elements, and other sources. The names of the drugs include opiates or narcotics like MS-Contin, OxyContin, Opana, Vicodin, Percocet, Lortab, and others. Benzodiazepines like Valium, Klonopin, Xanax, and Ativan, and headache and muscle relaxation drugs such as Soma, Fiorinol, or Fioricet. Too much of any of these drugs, or an overdose of a combination of them, can and often do prove fatal.
Well, the trail through which prescription drugs wind up getting on the street is just fascinating. About 20% are either stolen in large amounts from a regional pharmacy warehouse or actually ordered up on the web. About 80% of the prescription drugs that are abused today are filled one prescription at a time from the patient to the physician to the pharmacy and then sold or given to a friend or family member who then sells them on the street.
The Addiction Pros have created a 90-minute DVD training program on prescription drug abuse for physicians and other behavioral medicine professionals. It's also useful for consumers who may have a prescription drug abuse issue in their family.
Basically identifies the magnitude of the problem, who has a problem, how to figure out whether a patient has problematic behavior around their use of prescription drugs, and how a drug and alcohol treatment program or a mental health facility can collaborate and cooperate with primary care physicians and pain management programs in the community in order to jointly approach and deal with individuals who are suffering and desperate from prescription drug abuse.
Information on the DVD training module on prescription drug abuse and other staff development and continuing education programs is available at www.theaddictionpros.com.